Next at 6, Eyewitness News takes you inside Bernie Madoff's posh Manhattan penthouse. Plus, the MTA Just Raised fare. Now see what they're taking away from strap hangers. Join Bill Ritter and Liz Show next at 6 on Eyewitness News.
A new medical room tool was unveiled today at a local hospital, and it soon may be rolled out in many more.
This is a tool that helps doctors test or treat patients who may have been exposed to the virus that causes AIDS, HIV. Dr. Jay Adlersberg is here now with more. Jay.
Shade, Diana, 2 doctors came up with this tool to help educate medical professionals on how to treat patients who may have been exposed to HIV, the AIDS virus. It's not well known by the general public, but there is a therapy that could prevent someone from getting infected with the virus if they had an exposure. There's a combination of 3 or 4 medications that can be given to someone exposed to HIV which may prevent infection. For years, the drugs have been used in hospitals for medical professionals who may suffer an accidental exposure from needle sticks, for example. And in some cases, they've also been used with people exposed through drugs or sex to HIV. The therapy is called PEP, which stands for post-exposure prophylaxis. Prophylaxis is the medical word which means disease prevention.
It's a series of medications called antiretrovirals that patients take for 28 days daily.
Dr. Tony Urbina and his colleague Paul Galatowicz today unveiled a new computer program at St. Vincent's Hospital. It's meant to help doctors and other medical professionals understand and use PEP. Non-occupational PEP, or NPEP, is its use in those who have been exposed outside a medical setting through sex or drug use, for example. St. Vincent's Hospital has treated dozens of patients for non-occupational exposure to HIV. Dr. Daniel Egan worked in the emergency room.
At St. Vincent's, there were a number of patients who presented looking solely for post-exposure prophylaxis in a non-occupational setting, most commonly a sexual exposure.
Post-exposure prophylaxis is not optimal treatment. Many people can't continue the 3 or 4 drugs daily for 1 month because of side effects. Still, this information program developed with state funds is available for use.
We would like that every single hospital, community health center, and any other clinical institution will have it, use it, and we will give it to them free of charge.
The use of non-occupational PEP is not without controversy. There are no studies that show it works in this setting. Also, HIV exposure in a medical setting is usually a one-time incident. Some fear that making PEP available to the lay public might encourage unsafe behavior. Patients must receive therapy within 2 to 3 days. Shade.
Okay. Thank you, Jay.
Thank you, Jay. And that does it for this 5 o'clock edition of Eyewitness News. We thank you for watching. I'm Diana Williams.
And I'm Shade Better-Noir. Eyewitness News at 6 is 45 seconds away.